I'd like to pivot to something personal, because
Sure.
we did know each other for a while, and we did a photo shoot here in my studio a while back. But we had talked about my daughter who has type 1 diabetes, and you turned us on to the endocrinology unit there.
Yep.
And through that conversation, you told me you were sharing about your wife has had some very serious ailments in terms of her own endocrinology and that type of thing. And you referred me to her specialist who's at Metro Health, and
Yep.
you're like, this is who my wife goes to.
Yep.
She could go anywhere in the country to see
Yeah.
anybody, but
Yeah.
this is the dude.
Yeah.
And now my daughter sees him. But how does it shape when you have somebody in your family who has some, you're not just a health administrator, you're a husband and a father,
Yeah.
but how has that created empathy in your own life in terms of how you care for patients?
Well, everything that I'm doing today, I really think about is to make things better for her.
Yeah.
And I think when you're, as a physician who's a patient, or a physician who's a husband of a patient, that's a very uncomfortable journey. We know, as good as the healthcare system is, there's always opportunities to be better. We do know in the United States of America that the third leading cause of death is medical errors, right? And those happen in environments like hospitals or ICUs and things of that nature. So it's a very uncomfortable journey. I mean, I'll just kind of relate at a high level. Our healthcare journey with some of her endocrine issues started back in 2018. She developed something called the pituitary macroadenoma. She had a pretty involved surgery, brain surgery, to get that resected and addressed, and thankfully everything is okay there. Several months after that surgery, she went and saw her endocrinologist, who was sitting across the exam room, and I wasn't there for this visit. This happened in Portland, Oregon, where we used to live, and the endocrinologist said, "Hey, can you swallow? I think I'm seeing something in your neck, like a little lump in your neck." And so my wife was like, "Oh, sure," and then put her on the exam table, felt that thyroid, felt that it was abnormal, felt like she felt a nodule. So then we got referred. This was now after the brain surgery, 3 or 4 months after the brain surgery for the pituitary issue. Now there's this thyroid issue that's out there. And so, got a biopsy of that nodule. It came back as something called papillary adenocarcinoma of the thyroid. The good news with that cancer, if there's any good news, is that it tends to be indolent, tends to grow very slowly for the majority. Although at the time my wife was in her early 40s. And so then that meant another surgery, and there were several different options. I'm not going to get in all those details, but the right choice for her was to completely remove the thyroid, and that's what was done. And she's, knock on wood, has had a good result. This was all back in 2018. When we moved out here to West Michigan and Grand Rapids, we hooked her up with a couple of people that are in my group at Metro Health. She's had great care at Metro Health, wouldn't change anything about it. But one of the things that we wanted to seek some answers to was, she's quite young to have these multiple endocrine issues, someone in their early 40s when diagnosed with some of this stuff. And so, Metro's not far from a world-renowned organization called the Mayo Clinic. And just actually as this sort of pandemic was starting to shift around in America, earlier this month, which was March of 2020, we went there and saw some of those specialists, kind of were able to squeak in before things really got kind of tighter. So we had her see, people in the endocrine group, the thyroid group, the genetics group. She also has high blood pressure, so we went to the hypertension group, women's health, few other spots. We want some, answers around what are the implications for our children. We have 3 children. 2 boys and a little girl. The boys are teenagers. My daughter's 9. And so we wanted to know what, if any, implications there might be for them. And so that was one of the main drivers of wanting to seek out that place. And I can say a lot of comfort came from the care that she received, the validation that everything that she had at wherever she had it was on track in the Mayo experience, right?
Yeah.
And that there was opportunity to potentially draw some blood and bank it for genetic testing. It's not...
Well, that's the field that they really shine too, is that sort of specialized finding genetic factors in things. we tend to, with two of my daughters, we've been frequent flyers for different reasons for things, but we had umbilical cord stuff tested.
Wow.
To find
Yeah.
why my youngest daughter had a hemorrhage in utero, a brain hemorrhage.
Right.
So, the went off there, and so that's a center of excellence for a lot of things. But that genetic factor that you're searching for,
Yeah.
because you're projecting through the health of your next generation
Yeah.
and kids, and
Yeah.
wondering how you can plan but certainly as someone who's a leader in a healthcare organization, a large one having a big impact, when you're so immersed in the care of your own family, it has to bring some other perspective to how you're projecting the future and how you want to drive excellence through your organization.
Yeah. So just a little perspective. We do about almost 550,000 visits annually at Metro Health. These are those face-to-face visits that I was talking about earlier. And, my role today is really focused on how do we make sure that those people get the best care consistently all the time. And that my role as the leader of the group is to really make sure that we're bringing in the best physician talent we can possibly source to that our primary care physicians can refer to.
Yeah.
Because I think presenting awesome specialist solutions to primary care physicians is a big part of my job, right?
Yeah.
And in some areas we may not be as strong as we need to be, and I will fight to make sure that we have great solutions across all the areas that we're choosing to focus on. I think of that as one of my main roles, is making sure that if you join our group that we're going to get high quality people for you to refer.
This Full Exposure podcast episode has been made possible through the support of Metro Health, University of Michigan Health, and Dr. Peter Hahn, who believe that creativity and the arts are essential to a rich, healthy, and fulfilling life.